Hello there, this is Dr. Ridwan, and today I am going to discuss about the Glasgow Coma Scale. The Glasgow Coma Scale was first published in 1974 at the University of Glasgow by Dr. Graham Tisdale and Dr. Brian Jennett. It is used to describe the extent of impaired consciousness in all types of acute medical and traumatic patients. The use of the Glasgow Coma Scale became widespread in 1980s when the first edition of the Advanced Trauma and Life Support recommended its use in all trauma patients. Additionally, the World Federation of the Neurological Societies used it in its scale for grading patients with subarachnoid hemorrhage in 1988. The Glasgow Coma Scale and its total score have since been incorporated in numerous clinical guidelines and scoring systems for victims of trauma or critical illness. Glasgow Coma Scale has three major components. Number 1, eye opening. Number 2, verbal response. Number 3, motor response. Each of these components has a lowest score and a highest score. The lowest score for eye opening is 1 and the highest score is 4. The lowest score for verbal response is 1 and the highest score is 5. The lowest score for motor response is 1 and the highest score is 6. Therefore, the lowest GCS score possible is 3. And highest GCS possible score is 15. We start the GCS examination with eyes. Look at the patient's eyes. Eyes can either be opened or closed. If the eyes are opened, then the score is 4. If the eyes are closed, then ask the patient to open their eyes. If the patient is able to open the eyes in response to speech, then the score is 3. But if the patient cannot open their eyes to speech, then apply painful stimulation. We can apply painful stimulation in different ways. The most commonly used one is the supraorbital pressure and applying pressure on the nail bed with a pen. If the patient opens eyes with painful stimulus application, then the score is 2. If the patient does not open eyes, then the score is 1. After completion of examination of the component number 1, we move to the next component, which is verbal response. To examine verbal response, we ask the patient questions about time, place, and person. Question number 1. What is the date today? Or what month is this? Question number 2. Where are you right now? Question number 3. What is your name? Or could you make an assumption about who I am? There are 5 possible ways the patient could answer. Number 1. The patient answers these questions right. Number 2. The patient answers this question wrong or looks confused. Number 3. The patient says random words, those are not related to the questions. Number 4. The patient moans or groans or makes sounds or noises that does not make any sense. Number 5. The patient does not respond. From number 1 to 5 situations, we score from 5 to 1 in a chronological order. The less response the patient makes, the more severe underlying cause there can be. Finally, we come to examine the motor function of the patient. To do that, we start by asking the patient to make a fist or grip my fingers or protrude your tongue. If the patient can perform the task accordingly, the score is 6. If the patient is unable to perform the task, then we move to the next step. Apply supraorbital pressure or pinch on the trapezius muscle, or apply nail bed pressure. The time for application of pressure should not be more than 10 seconds. We can expect 5 kinds of responses from the patient. Number 1. The patient will localize the pain and try to remove the examiner's hand. If that happens, the score is 5. Number 2. The patient will flex their arm slightly up to the chest or try to withdraw from the pain by moving the head or hand away from the examiner's hand. In that case, the score will be 4. Number 3. The patient will curl up both of the hands and bring them up to the chest and below the chin while extending both of the ankle joints. It is also called the decorticate posture or abnormal flexion. The score here is 3. Number 4. The patient extends both of the elbow joints, also the knees and ankle joints remain extended. Then the score is 2. This is also called the decerebrate posture. It is very alarming. Number 5. The patient does not respond and the score is 1. A GCS score from 3 to 8 means the form of injury is severe. A GCS score from 9 to 12 means the injury is moderate. A GCS score from 13 to 15 means there is mild or no injuries in the brain. Check if the patient has taken any medications that may alter the response, such as sedatives or drugs. Check for any hearing or speech impairments. Check if the patient has any injury on the face or eyes, or in the areas of the body where the painful stimulus is likely to be applied. Check for any language barrier. Glasgow Coma scale is a very handy tool for the physicians all over the world for the determination of the severity of the trauma in the patient's body to provide proper treatment or to refer the patient to a higher center. Sometimes it can be very confusing to perform or recall the process for the physicians. It takes practice. So it's better to perform the examination regularly on patients irrespective of presence or absence of any head injuries. That's all for today. I hope you enjoyed the video. I will see you in the next video. Till then, take care.